I think the best outcomes really happen when we have the science and then we have the space to what I believe is full body alignment.
It's one of those sufferings that's hard to
Yeah.
hold. It's
Yeah.
so hard to hold. We know we survive, but there's a part of us that is never, ever the same.
There are highs and lows of every fertility journey, and we need these multidisciplinary teams from the beginning to set ourselves up for success, really. It's just so incredible because the whole point is to take back our power when infertility renders us otherwise powerless.
You're listening to Solving for Joy. I'm your host, Dr. Chrissy Ott. Hello, friends, and welcome to today's episode of the Solving for Joy podcast. Today's guest is my friend, Dr. Erica Bove, who brings both wisdom and gentleness and fierce clarity to one of the most complex areas of medicine, fertility. Dr. Bove is a reproductive endocrinologist, physician coach, and the founder of Love and Science, Thriving Through Infertility, a space where evidence-based care meets soulful whole person support. And what I can tell you right now is that I would have felt so supported had I had a similar connection in approximately 2005 through 2013, but especially 2011. What I love so much about this work is that Erica doesn't just help people through treatment. She walks them through the bigger questions about identity, about grief, and of course, about joy. She is someone who helps people feel seen in the moments they need it the most. So this topic is close to my heart. We had our own fertility adventures. We may get into those a little bit, but Erica, I've been so looking forward to this conversation and welcoming you to the podcast. Thanks for being here.
Me too, Christy. Thanks so much for having me.
Absolutely. I would love to hear a tiny bit of the origin story of Love and Science, if you're willing to share.
Absolutely. So let's see. So where to begin? So I like to start by saying I went to med school to be a psychiatrist because I've always been deeply fascinated by what motivates people, how to help people with their minds and their bodies and all of their emotions. But then I went to med school and I was just captivated by OBGYN. I just thought that women's health was so meaningful and exciting. And so I sort of course corrected, but I don't think that interest in understanding meaning and motivation and all of that just never went away. I've always been very curious about that. So I went through my OBGYN training and residency and then did my, reproductive endocrinology and infertility fellowship. And as I was getting into practice, I was just angry, disheartened, sad in terms of the way that I knew people need to be cared for in the context of their fertility journeys and what I could actually do in the clinical setting, right? It was like, okay, I have 30 minutes to talk to you about your diagnosis, your labs, the treatment options, and then let's see if we can settle on a way forward. And I'm an empath, right? So I could just tell in the context of these visits, this is not good care. Even though I'm I thought, oh, okay, well, I'll show them some studies from PubMed and maybe that'll make it better. Or, I'll bring the partner in and see if we can, nothing that I did for a little bit worked. I was I'm doing my best to provide good care and something is missing. I just did not know what that thing was until I went to coaching school. So I went to coaching school during COVID, kind of on an intuition. I was I drank the coaching Kool-Aid for myself. I'd done parenting coaching and relationship coaching. And I was I think I'm going to be a coach. I don't know where this is going to lead, but I'm going to go to school and learn. And as I was doing the classes for the coaching school, I had this light bulb moment. I was I think this is what my patients need. I think they need these tools to really see them in their individuality, understand their values, making empowered choices that reflect who they are as an individual. And even if I can say, hey, I see where you'd like to get, you'd like 2 children, this is they need to find the answers within themselves, right? And so that's what coaching does, is it holds space to say, I see you in your humanness, I see your dreams, I see your grief, I see all of it. And this is what I see. And how can I help you find your own answers, which are empowered, right? Because we use evidence, but they're also allowed to come to fruition in this beautiful space of love. Yeah. So then I did
Just want to like hold that with
it.
some silence around it because there's so much
Right.
goodness in
Right.
there.
Right. So I mean, I started trying it out to see if it would work, right? So I remember one time I had this patient of mine, and she had done 3 IVF cycles with her own eggs. It really did not look promising that it was going to work if she kept doing the same thing. And I started to suggest to her, like, have you ever thought about an egg donor? And it was like the end of the appointment, right? And I just remember saying, you know what, like, I am going to introduce this idea. I want you to talk about it with your husband. And I want us to meet in 2 weeks, and it's going to be a consult only appointment. And we're going to talk in 2 weeks about what it means to be a mother. And that's what I want to talk to you about in 2 weeks. And I have no agenda. I do not care if you pursue donor egg IVF, if you do more treatments with your own eggs, if you stop treatment altogether. I want you to make the best choice for you, and you need the space to do that. And so we met in 2 weeks, and we had this conversation, and just her own ability to connect with, like, oh, this is why I'm here. This is what I think it means to be a mother. Within that context, what does that mean in terms of my own treatment options? What would I consider? And then instead of just it being like, well, these are your menu of options, it was like, how can I grow into this decision in a way that makes me feel like I'm making the best choice for me, right? I always say you'd never want to look back 5 years, into the future and say, well, if I had really only done that other thing or made that other choice or tried that out. And so she was able to cross the bridge to make the best choice for her. But I think it's only because I was able to have that deeper conversation with her that then allowed her to move forward, if that makes sense.
Totally makes sense. What you described at the top was really that you were experiencing moral injury
Yes.
as a
Mm-hmm.
practitioner because time pressures and so much of the care gets taken out of healthcare when we are treated like, widget producing mechanisms.
Yes. Yeah.
And in some ways, coaching skills and the time to implement them um, was a way of resolving moral injury. It
100%.
actually puts the connection back and the agency back,
That's right. That's
which
right.
is so
You're
profound.
right. I feel like
So
now I'm able to
profound.
provide good care. Yeah. Yeah.
That's amazing. My curiosity brain would really like to know, what did she choose to do?
Donor egg.
Yeah. Yeah. And I could sense the thought model in what you were describing.
Yeah.
Not that that's the, end all be all of coaching tools, but I think it's definitely one that it's utilized frequently. And that is, where we are looking to know ahead of time, what result are we aiming for? And then what are the actions that will get us that result
That's right.
in a way that we are aligned with, right?
Right.
And what are the feelings and thoughts that we need to choose and generate and direct our mind toward in
Yeah.
order to manifest the actions and the results that we're aiming for?
100%. And I think, I always tell my clients like 95% of what goes on happens in our subconscious. So
Yeah.
we have to bring light to, like, what limiting beliefs do I have that are in this complex being? And, for some people, it's like, ideas about parenthood or generational trauma, even. And I think that really kind of understanding, like, how is my operation at baseline, and what are my thoughts and my feelings like at baseline, and is that how I want to be? And if not, then how can I make these slight shifts? Like, you got to challenge the thought, like, is that thought true? In order to be a mother, the DNA has to belong to me. Like, is that thought true? And for some people it
Exactly.
might be, and for other people
Hmm.
it might not, but that's where the individual, curiosity comes in. And that's why I feel so good about this work, is because people tune in and they really connect with their deepest why, and then they can make the choices from that much more powerful stance.
Yes. And then you hold that thought up to the light and say,
Yes.
does it have solidity for me? Do I still choose this thought, or is it causing unnecessary delay, unnecessary pain? And let me tell you, from the inside of the infertility beast, there is so much accidental, subconscious thought happening.
Yes.
So many rules, so many, well, if I follow this, then that will happen.
I know.
And we set ourselves into, I'll speak for myself, but I had, I had some rules that I didn't realize I had, at first, or some of them were expectations,
Right.
you know, like I've told the story before, um, that we popped a bottle of champagne after our first at-home insemination because we were just done,
That's
So I
right.
had an expectation in like 2005 that did not come to fruition until
Mm.
2013. Um, and all along the way, even with therapy, even with a team of beautiful people supporting me, this particular, like, let's examine the thoughts. Does it serve
Right.
you to feel victimized by your circumstance over and over again?
Right.
To focus on
Yeah.
the I don't understand. Why? Why us? Why not us?
Yeah. And
So
am I
much.
failing, right? Like a lot of the people
Absolutely.
I work with, especially very high achieving women, feel like they are failing. They're failing themselves, their potential future children, their spouse, if they have a spouse. And I think a lot
Mhm.
of it is really examining the shame, and the guilt, the regret, all of it, and learning how to forgive ourselves, right? And
Yeah.
just really saying, like, is it really your fault this hasn't worked yet?
Yeah.
Really? What would you tell your best friend?
Mine, I mean, I think it's so interesting and telling that that can be directed inward or outward. In my particular style of processing, it was directed outward, like
Huh.
the universe. Like I was shaking my fist at the sky,
Yeah.
thwarted in my hearty endeavor, until not. But there's so
Mm.
much in the texture of surrender that I might have grokked at an intellectual level during those years, but I could not bring it down into an embodied experience until I could.
I'm so curious about that, and I'm so grateful that you could. What do you think allowed that shift?
Oh, girl.
Because if I could just bottle that up, which I know is not possible, like,
I know.
was it a moment? Was it a transition? Was it like a
Mm,
season? Like, was it like a conscious letting go, an unconscious letting go? Like, what do you remember from that time as you think back to how
Let me
you
think
were when
back.
you were more in your head, and then when you were able to drop into your body and allow, and ultimately, sort of after all those years, have your journey come to fruition?
There was definitely a season, and the season contained, going to Peru for medicine ceremony. The season contained having energy work and acupuncture and
Mhm.
lucid dreaming about energy work and prayers and bargaining. The season contained all of those things, but one of the stories that I tell myself, there was body work involved, but the cycle that we got pregnant with Isa, there had been some recent energy work and body work, but that's true for many, many times. um, and it was about 6 months after we had gone to the Amazon. And I had finally opened up this file on from my Dropbox that were the essay questions for considering the possibility of adoption. So they are the essay questions that you answer. So it was actually this moment of
Wow.
introspection and reflection. And I think opening the door of surrender to, okay, universe, if the answer is no, one, fuck off, but also by any means necessary. And
Yes.
so there was a little bit of, I am willing to open this door. I'm
Mm.
not, I hadn't decided, we had not decided, we did not feel intuitively that adoption was the path that we were called to. And
Mhm.
I feel like so much of my consternation was because reality was in contradiction to my intuitive knowing. that I had a
Mm,
child on the other side of the veil, and why couldn't she or he come to me? Why couldn't they
yeah.
come?
Wow.
So that's a long and sort of rambly answer, but I think there is some medicine for me in opening the door to adoption, even though it's not what we eventually walked through.
That is beautiful. And thank you so much for sharing. I full body chills over here. Like I just that is surrender. I mean, that is surrender. And I'm just so grateful that you were able to do that. But
Yeah,
it
that
also takes tremendous courage. Tremendous, because you got to look that what you think you don't want in the face, right? And you have to be like, I always say to my clients and my patients, like, we need to go to your worst possible outcome. We need to go there. Like, we need to say, like, we don't need to. I mean, if it doesn't happen, it doesn't happen. But I think your chances are going to be the best if we can go to that which you fear the most. And that's like badass courage right there.
is badassery. And it's what prepares you also for holding the heart-wrenching beauty that is parenthood when you're fully
Yes.
immersed in it. I'm not saying every moment of being a parent is full of beauty, hello, because I live in the planet. But
Yes, I know.
I said many times out loud, I want it all, universe. I want the good and the bad and the ugly. I want the complicated. Like, give it to me.
Mm-hmm.
I am here for it. But
Yeah.
it did take some
And
surrender.
yeah. And I mean, now that you have Isa, right? Like
Mm-hmm.
you then model how to handle the hard things and how to surrender. Like it's so hard to watch our kids suffer.
Yeah.
Um, I truly deeply believe that part of why I'm here on this planet is to help my children to learn how to suffer well. And with
Yes. Oh my God.
yeah,
So beautiful.
yeah, yeah.
That is so beautiful. I have full body chills now.
Yeah, this is deep.
Yes.
Deep
I
work.
mean, suffering is unavoidable. Like,
Yeah.
we come down here, mess around in this little meat suit, separate from our deepest truth, and try to find our way back for fun.
That's right. That's right. Right. And sometimes separating from those we love the most, right? And even
Yeah.
like miscarriages, like why do miscarriages like this brings up so many existential questions, right? Like was there a soul in there that then was there and then left? And if this has happened, I have one client and she was briefly a mother, right? And then Mother's Day rolls around and she doesn't have a child in her arms yet. And a lot of our work was like connecting with her identity. Yes, you are a mother. You are a mother. Even if the world doesn't see you that way, it doesn't matter. You are, and let's connect with that. It's
Said that repeatedly in our
mhm.
in our journey. Like, we
Yeah,
are parents who have not met our child yet. And
that's
I'll
right.
tell you, Erica, like, I'm coming out of the closet with all of my woo today. But during the worst part, when we had our IVF miscarriage,
Hmm.
there were several. I mean, there was a lot. But when we
Yeah,
had our IVF miscarriage in particular, it was such a shock because, we went from
yeah.
the pinnacle of success to like the pit of defeat in an
Yeah.
instant on an ultrasound
Right.
screen, which so many of us know that feeling. And
Yes.
it's gutting, it's coring, it's also somebody's every day. Like, they do this all the time. And that hurts my heart so, so deeply.
Yeah.
Um, so when we had that
Hmm.
miscarriage, we connected with a medium, you know,
Hmm. Oh,
a
interesting.
psychic. And we knew her from before, and we had a reading with her because our hearts were just bleeding. We were like,
As they
somebody
do.
help
Yeah.
us, somebody help us. We
Yeah.
were so devastated. And financially devastated, like
Mm.
70 grand out of
Right.
pocket, guys. Like,
I'm so sorry,
it
Chrissy. I
was
just have to say,
not
I'm so sorry you went through
like,
that. Yeah.
thank you. And
Yeah.
the psychic said to us that that particular baby had like a soul contract that if he had been born, he would have died by age 3. That was part of his
Wow.
contract. And so the suffering of this was then contextualized in the suffering of that. and there was room for some kind of fucked up gratitude in the midst of like our worst pain, because we could imagine that that pain would be, even more devastating. And my heart and arms around every parent who has lost a young child in that,
Yeah.
age range, because it's really, it's one of those sufferings that's hard to
Yeah.
hold. It's
Yeah.
so hard to hold. We know we survive, but there's a part of us that is never ever the same.
No, in my family of origin, I'm the oldest, and I had a sister. She's still alive, Francesca. She's 21 months younger than me. And then when I was 3.5, my parents had another daughter who actually passed at 2 months of life, 2 months, um, due to H. flu meningitis. And like watching my parents go through that horror, like I remember it so vividly, even my 3.5-year-old little self. I mean, her spirit is still like, I will tell you, there was a stormy night like 2 months ago. She got me home safely. Like, she is still a part of our family, and I can feel her spirit. And even like my amazing help nanny, I don't even know what to call her. She's like an angel. Like, her name is the same name as the sister we lost. And so like I do believe in the journey of souls, and I've had miscarriages as well. I would never wish it upon anybody. But I do think that sometimes like perspective in that way, you're like, okay, well, this happened, and that sounds horrible. This is absolutely awful, and that sounds like something we wouldn't want either. And so how do we just get the strength to grieve and move forward?
I'm so sorry that
Yeah,
your little sister was lost. What
thank you.
what is her name?
Gabrielle. Yeah.
Gabrielle.
Yeah. And then my
Oh,
parents went
and
on to
that's an
have.
angel's name.
It is. Yeah, it means the Lord is willing. Yeah. Um, and so then my parents went on to have two more children who, interestingly, the timing wise, they would not be here if it weren't for the loss, which is, just so you just understand how one thing leads to another. And like even this year, I was with my parents at a fundraiser on, I'm trying to remember if it was I think it was the death date, actually, not the birth date. And we looked at the program and we just had a moment of silence, like, wow, this day, all these years later. And so I think that's what I try to tell my patients and my clients is like, this will always be with you, and it's kind of like trauma. Like, it doesn't define us, and it is with us, and it's part of our story. I will tell you, I speak to patients much differently after my own personal experiences. And even just the way I would describe, like, we used to manage the beta book when I was a resident. These are people who come in with positive pregnancy tests, but we don't know where the pregnancy is located. And,
Yeah, that's
I
beta
used to say, and
HCG for anybody who's wondering.
yeah,
Yes.
yeah, thank you. And I used to say, and I'm just admitting this out loud, like I used to say, oh, like good news, it's not an ectopic, like it looks like you've had a miscarriage. And then after I went through my own experiences, I mean, coming back, I'm like, wow, like that was kind of naive, but like how would I have known otherwise? Again,
Yeah.
release the self-judgment. But then, after I had my first miscarriage, I could say, like, with empathy, like, I am so sorry. I'm here to give you this news. It looks like you've had a miscarriage. And like, it wasn't like, oh, great news, it's not an ectopic. It was like, you've had a loss and I want to honor that. Like, it's much
Yes.
different.
I
Yeah.
was actually just going to call out and acknowledge how you have twice, or at least twice on this call, modeled so beautifully how to create a moment of space and connection to say, I'm so sorry you experienced that loss. I'm
Yeah.
so sorry for your loss. That is what to say, my friends, my loves, my beautiful
Yes.
friends out there. Anybody
Yes.
who's ever heard
Yes.
the words, when are you going to try again? Or at least you can have another one, or it
Mm-mm.
could have been farther along. Please don't silver line this loss. Please just
No.
hold space.
No.
God bless you for your efforts, and please don't do that.
Yes. And can I add a really useful thing to say? Like, we say what not to say,
Absolutely.
but it's not your fault.
It's
This was not your
definitely,
fault.
oh, so, so, so
It's
important
like even
to
the
hear
word
that over and
miscarriage
over
is
again.
so fucked up. Like, it is not your
True.
fault. It is not your
True.
fault. Yeah.
Yes.
And that's the one
Miscarriage.
thing.
The
Yeah.
carrying was wrong.
Yeah.
Ugh.
Exactly. Exactly. Um I've chosen to start saying like either early pregnancy loss or pregnancy loss because and like a stupid biochemical, again, words are so powerful. And I always meet people where they are. If they prefer a different language, then I use that language. But I just have so many problems with our language around this. But anyway, I digress. I think that just holding space and reminding people, that was the one thing my OBGYN said to me, during my loss during residency, was like, I'm going to talk to you like you're a patient, and because I was a patient, even though I was an OBGYN resident, she was like, this is not your fault. And I'm like, it's not because I operated for 14 hours yesterday. Like, she was like, no, it wasn't because I ate from the taco truck on Tuesday. Like, we always go back and blame ourselves. But that's the one thing I always make sure to say that to each person, because I mean, you know, it's never the person's fault.
And I'm so sorry that you went through this.
Thank you. Yeah.
I love the name Love and Science. It stopped me in my tracks. I knew that we were going to be friends. How did you get the inspo for
Yeah.
Love and Science? Was it just like a direct download? Tell me.
Way back when I was in training, I saw a onesie that said, and this was meant for, babies conceived through assisted reproductive technology. It said, made with love and science. And so I shamelessly borrowed that because as I think about, speaking of the woo, like, the woo is real, folks. Like, the woo is real. Like, we discount it because, like, we don't have a randomized controlled trial, but, like, it works. Like, and I think that, in order to for this to work, like, then I started, as an attending, I would say that during my transfers, like, love and science, like, this is made with love and science, to remind ourselves that the love is there. And, like, I will tell you, like, yeah, this week was very intense, and there was a patient I very much wanted to get pregnant, and she had one egg which fertilized, and so we had one embryo to work with, and I was very careful, as I always am with the transfer, right? And I put the embryo in, and I just like put every bit of energy I had. I don't know if she's pregnant yet. I feel like she's gonna be, just because I can sometimes feel it in the OR, usually can. But I know, but I just like prayed over her uterus, and I was like stick. And then of course I gave her a hug, and then, for your folks who need a little more lightheartedness than this deep conversation, we had the same water bottle. And so then I made sure that we cheersed our matching teal, and hot yellow water bottles, because that's so human too. I was like, we have to celebrate this moment, and anyway, it's just like, it's once I realized that I could really be myself, which again is a process, like, speaking of joy, like, you got to figure out who you are, and then that made
And
me a better doctor.
be it
Yeah.
so hard.
Like, laugh with my patients, cry with my patients, give fist bumps, like, whatever it is, like, that is authentically me. And so once I started to, like, release that, then it was like, okay, like, it's all over, like, this is me. And patients, I would say, respond well to that. But I think that that's a perfect example of, like, the love and the science. Like, we have this beautiful high quality embryo. We have this patient who had gone through an awful lot in the last week medically. And here I was as the conduit, right? Like, just like, okay, channel this, like, let this be. If this is her highest good, if this is their highest good, like, please let this little embryo stick. And I could just, like, feel it flowing. And so that's really why, because I think that, sure, it's just like, do you choose a surgeon who has, like, an excellent bedside manner, or do you choose a surgeon who is really good at surgery? Like, the question is,
Yes.
why do we really have to choose, right?
The answer is yes, I want both.
Yeah, right. I want both. And so, like, how can we, as physicians doing this work, like, how can we embody that? Because I think the best outcomes really happen when we have the science, and then we have the space to what I believe is full body alignment, right? Like, if we talk about receptivity, we need full receptivity. We need the receptors. We need the embryo to find its home. We need all those chemical and mechanical things to happen. I'm nerding out for a second, but, like, we truly need receptivity and full body alignment. And so what helps us to do that is the surrender, the letting go, the emotional regulation, feeling the feelings, letting all of it pass through. And that's where I see the best outcomes.
Wish I had a time machine. I would rewind it, and
I
I would
know.
fly my ass to Vermont to be your patient. I
I
seriously
just,
would.
I so wish we had known each other then. I don't think I could have served you in those years, because I don't think I was the version of myself now that I could have helped
I'm
you in that
so
way.
glad you are serving
Um,
people now.
yeah. But what I will say is, I think part of our coming together, and I feel this deeply, is, we all heal, right? Like, grief is a spiral, and we have all these layers of healing. Like, at some level, I feel like our coming together is to heal parts of what may be unhealed from that process, to be like, it's okay. Like, you learn what you needed to learn, and there's always tender spots, right? And we don't understand why we all come into each other's lives as we do. Time is really just a construct, but I think we all have our own healing journey, and it feels like this is part of that.
I receive that and
Yeah,
amplify it. So may it be of benefit. I absolutely
yeah,
believe that just knowing you're out there heals that piece of me that was missing, um, this kind of energetic connection and support
yeah,
during that
yeah.
time. So, yeah, you're doing miracles every day
Thank you.
and with heart and obviously in like a somatically aligned and integrated way.
Yeah.
Yeah,
Thank you. Which also means
yeah,
I need to be somatically aligned and integrated, because we can't be the
absolutely.
channels unless we pour into ourselves. And so I
Oh,
think that
yeah.
kind of ties with the joy, because if I'm blocked, then it's not going to flow through. It's not going to
Great
be the
turn.
best.
What are you
Yeah.
doing to stay aligned and open?
Oh, so many things, so many things. So I think my body, I think I've gotten really good at knowing when something's off kilter.
Uh-huh.
That's like the first thing, is just
Yeah.
like I used to just like be so cerebral and like not in my body at all. And I recognize too, like I'm like, oh, I'm spinning. I'm, not in my body. And so when that happens, then I have to say, okay, I recognize this state of like misalignment, out of balance, whatever it is. I'm just like not here. Which is why I love that we grounded before we got on the call. Like we got on the call, and then we listened to my favorite song, and I truly connected with the divine before we had this. It was just so powerful. So then I say, okay, what do I need to do in this moment? Is it canceling something? Is it going to yoga? Yoga never disappoints. Is it going for a run outside? I'm grateful to live in such a beautiful place with nature. Is it snuggles with my children? And I'm so grateful to have them. Is it journaling? And so there are certain things, like I have some structure, like I get to an in-person yoga class at least once a week. That's just like a hard, like I just don't not do that. And yeah, and I have I love Orange Theory, and so that gets my prana going. And so I like to move my body. That always makes me feel joyful. And I do it with friends, and I sing on the treadmill because I've decided I just don't care anymore. So
We are the same. I call it treadmill karaoke and
oh, I love it.
I love to appall my family with it. I get really into it if it's Jewel, like from the early 90s.
I love Jewel. Yeah, that's amazing.
It is. There's so much energy
Yeah.
moving when you do that.
I know. Yeah. So, I mean, and sometimes I need to see beauty, like, especially if I'm on call and it's been like, because I'm an empath, like, I do tend to absorb some things. And so sometimes I just need to go to an art museum or like like outside. If I'm in Vermont, there's flowers everywhere. But if, I'm other places, sometimes I go to a botanical garden and just like absorb the colors and the scents and like an embodiment, like get into my body. So all these things involve some sort of spiritual connection and movement usually, and connection with people I love. Not always. I mean, sometimes it's connecting with myself, because I am essentially an introvert. But it's that, and I love that you sort of your definition of joy, because I really do think it's like, okay, it's not a checkbox. It's not like, oh, all out of alignment, let's get joy. But it's like, I need to nurture myself, and what are my tools? I have a joy 20 list, like I shared with you earlier. Like I have like my list of things that are like automatic resets. But because this is how I want to live, and joy is such a driving force for me. And, if I'm not well, I can't help anybody else. Right. So, and it's just pleasurable. Like, I think we discount pleasure. Like, it's like, why would I not like put my nose in like a huge flower? Why would I not belt it out on the treadmill? Life's too short. Like, even yesterday, I was driving back from Vermont, and like the music came on. I just started singing and like loudly. And it's just like, can anybody else hear me or see me? I don't care. Like, this is how I want to spend my time, and that's it. Yeah.
Living out loud. I love
Yeah.
it.
And sleep. I mean, I think as best as I can, I try to get sleep, and I eat well, and like, all those sort of staples are in there. But I don't think that's sufficient. I think that's
Mhm.
necessary, but I don't think it's sufficient. I think I have to seek those times of spiritual connection to really fill my well. Yeah.
I really identify with, you know, benefiting from movement, and
Mhm.
beauty and nature
Mhm.
for sure. And then
Yeah.
sometimes I'm still just not willing to actually do the work. And I guess there's a bit of me that's like,
Eh,
I'm just going to kind of like hang out in this low level energy for a bit and yeah,
I feel that
ponder that.
too. Yeah, and I think that's like the last piece of this is the feeling the feelings, and it's like,
Mhm.
okay, like I can make my body feel better. I can savor this cup of tea, but like at some point I need to like journal about what's hard and
Right.
and share with a friend and like go to that deeper level. And so again, structure, like I have a standing conversation with my best friend every 2 weeks and we get on the phone and we have a gratitude practice, which is fantastic. We've done that since 2019, which I mean, that's just like currency for joy because, instead of just going through life, like I really savor things that I never would savor before. And I'm looking for things that are we try for 3 gratitudes a day and it's usually more than that because it's like, well, why do I stop at noon? Like there's a whole half a day left, you know what I mean? So that's been really
Yes.
helpful. But that's the hardest part, I think, is saying, okay, well, if I'm really going to help my clients and my patients feel their feelings, like I need to what I call being emotionally sober, be like in it with my feelings and just hold space for all of it. And
I like that
curious.
term,
Curious.
emotionally sober. When we
Yeah,
do another episode, sometime we can like dive deep into emotional sobriety. I love it.
absolutely.
I am creating a like a daily planner right now for clients. You're welcome to it also. That has like a 3 gratitudes practice built into
Amazing.
like the planner of every day. And I'm just going back into like really analog, super paper terms. Like, I
That's
just want
right.
to write on paper. I don't want it to be another thing on a screen. I want to have space to doodle. I want to have a blocked out area, words of encouragement at the top of the day and words of self
Yes.
appreciation at the end of the day,
Yes.
and all the badassery accomplished in the middle of the day. I'm very excited about putting
I'm
this
so
together as a,
excited.
like, it's not about productivity, it's about joy. Let there be
Yes.
both.
Let there be
Let there be,
both.
let there be both.
Yeah.
So, turning back to REI and fertility, um, what would you say is missing in that practice these days now? Like, how, and maybe not even just like fault finding what's wrong, what's missing, but like, how do you think we can link the clinicians to more of what you are embodying?
Yes, I think that we need to understand that mental health and support for mental health needs to be a staple of fertility treatment, just like we give ourselves medications every night, just like we check and make sure the pharmacy is all good and we do our acupuncture, like all the things because I think that a lot of times people think like mental health is just extra. Those for those people who are like really struggling or having a breakdown or almost at the hospital. And I think like early and often, like we need to people who show up at the fertility clinic in the first place at their new patient appointment, we need to invest in mental health support, whether that's a therapist who deeply understands this journey. I'm very grateful when I was at the University of Michigan, we had 2 part-time therapists on staff who were both excellent. And, from the very beginning, it was like, okay, and somebody has a miscarriage, which is obviously a horrible situation, like they're right there in the clinic who can provide support in real time. Like, so I think that like we have to understand that like there are highs and lows of every fertility journey, and we need these multidisciplinary teams from the beginning to set ourselves up for success, really. So that's what I think is the biggest piece is it's like, and that's, I mean, I think that's one of the biggest reasons why people, learn about love and science, and they don't sign up is they're like, oh, it's just extra. And I'm already paying so much money for fertility treatments. And I think what people don't realize is that to have that like built-in support, it just makes everything better. And people say, "Oh, my relationship with my partner is like the best it's ever been. We're like communicating and leaning on each other." And people speaking about identity, right? Like fertility takes up so much of the identity, and I encourage my clients to do things that are outside of fertility. So I have a client who's learning how to arrange flowers in Paris this week,
Hmm.
and that's her being like screw you, infertility. You're not everything. Like, if I'm hanging out my Lupron, I'm going to go learn, express this other part of myself that needs beauty. So it's really about like, how can I look at my identity and realize that I'm so much more than this journey and this process. And I think that that's really hard work to do by yourself. I think that most people need a guide to do that. And sometimes, like I said, like in real time, like there are more intense moments. Like, somebody gets really bad news, like, hey, your eggs didn't fertilize, or hey, you have no embryos from the cycle, or, you just had a miscarriage. Like, we need to have structures that allow for support in those moments as well.
I'm remembering this psychologist attached to my fertility clinic, and it really was just a check off list. Like, that felt like you needed to be deemed stable, to proceed, which was not the
Mhm.
same as, an intervention of support. If
No.
there had been, I'm going to say the word mandatory, but, everything is agency. But if there had been like a built in, this is your coach,
Mm-hmm.
to your fertility
Mm-hmm.
journey. Like,
Yes.
yes, you're going to know your nurse really well. Yes, you're going to know your doc really well and your pharmacist. But you're also going to know this coach. And
Yep.
this coach is going to check in with you every 1 to 2 weeks.
Mm-hmm.
And they're going to ask you to do some introspection, and they're going to ask you to do some exercises. I mean, what an incredible value add that would be.
Yeah, and I think we need community. We need community.
Mm. Hmm.
Um, this process is so incredibly isolating. People think that
Hmm.
it's just them, when
Hmm.
realistically, 1 in 6 humans has infertility. And that number even goes up in certain populations. Like, we need
Like
to,
physicians.
yeah, physicians, it's 1 in 3 surgeons. I mean, it's crazy. So, like, but everyone is in their own silo, suffering, thinking it's their fault, on the brink of divorce, like whatever it is. And I think the minute that we can come together and say, like, oh, it's not just you, or like somebody has a hard day and like somebody can see their story reflected in another person. I have clients who send each other cookies across the country. Like, I just think that,
That works.
I'm blown away. Like, I do support groups on Friday nights, and I'm just always blown away by the way that strong women are able to support each other through these hard times. And so I think that everybody needs a community, even if you're a super introvert like me, because we heal together, we're stronger together, and we need to create structures that allow for supportive groups. And one thing I'm super proud of is that my community, it's not a competitive space, it's a collaborative, supportive space. It's a nurturing space. If somebody has a transfer day, we rally around that person. If they have a egg retrieval, we get excited and we cheer, like all the things. But I think we need to heal together, and the only way to do that is to make it happen through supportive channels.
I love that. And it's a perfect segue to say in detail about your structure. Yeah.
Yeah.
Let's share with our listeners what you do as a fertility. Like, how do you work with people? What's the
Sure.
structure like?
So I think the backbone is the groups, truly, in terms of people having a space where they know they can come, where we talk about the hard things. The structure of the groups, it's interesting. We always start with the win of the week. And that's not to be Pollyanna, to sugarcoat anything, but our brains will naturally go to what's not working. And so if we can just take a little, like 5 minutes of time and turn our attention to what is actually working, and doesn't even have to be fertility related. Sometimes it's like, oh, I set a boundary with a colleague, or oh, um, I don't know, organize this really beautiful event. Like, it doesn't have to be fertility specific, but like, we all have things in our lives. It's the 50-50 of life that are actually going well. And we need to tune our attention to that. And it's like the gratitude thing, it helps us to notice it when it happens outside of those meetings. So we start with the win of the week and we celebrate each other, because we do it in community. It's beautiful. And then we then talk about what's hard. And I do laser coaching. I tune into my intuition, because this is obviously an intuitive endeavor. And if there has been like a clustering of things, like sometimes I truly turn into what I call Fuck It Friday. And we talk about like what's like super extra hard this week. And then, but the point is not to just air our grievances. The point is to say, okay, and how do we, help so and so in that Zoom square, like take back her agency? Like, how do we do that? And so, I will sort of offer the laser coaching, and then I open it up to the group. And it's amazing what comes from the group in terms of like, you know, hey, like I was in this situation, this is what helped me, or oh, have you considered this? And it's just so incredible, because the whole point is to take back our power when infertility renders us otherwise powerless. And it's just, what I can do, and yes, my one-on-one coaching sessions are very powerful, and I do offer those to some people who want it. And there's incredible power for transformation as we can really, hone into someone's detailed situation with lots of time. But I really do find that it's the group aspects that really promotes the most healing, which is beautiful. And then, of course, all my clients are nerds like me, and so we have content, we have videos and homework, and I really want to make this like sort of it like one-on-one. I want to make this like very palatable for people in the context of their life. And so this is what we do. We have homework, we have a text chat in between so people can stay in touch, and we have the groups and the one-on-one. And it's really about saying like, how can we get unstuck and how can we heal in community? Because I say this every day. Every one of my clients graduates as a parent. That is my hope. That is my intent. And so we don't know how long that journey is going to take, but we're going to walk you through so that everyone gets across the bridge to parenthood, in a way that is their path. And so it's just beautiful.
I love picturing you holding hands and walking people across a bridge to parenthood. It just feels
Yeah.
like so much deep accompaniment.
Mhm.
Um,
Yeah. And then, I mean, I always say, like, once you finally do get pregnant, it sets up a whole new set of anxieties and fears. And so, I have
yeah,
groups for newly pregnant people, and that sort of, is this going to still work? Is it not? Especially for people who have losses. And
yeah,
I work with people for however long it serves them, right? So sometimes it's an entire pregnancy because you can't really exhale until the baby's in your arms, right? So
yeah, yeah.
it's beautiful. So,
Especially if you live and breathe
yeah.
in medicine and you know all the different ways that a thing can go wrong.
Yeah,
Like,
and I mean, and you probably know this as well, like people who go through infertility treatment have similar anxiety and depression rates to people with cancer. And
mm,
there's a much, much higher rate of postpartum depression and anxiety in people who have gone through fertility treatments for reasons that are not quite, I have some theories, but I think we need to understand this is not just about like checkbox, like, okay, your embryo is stuck, you're moving on, or whatever it is, but it's about like full spectrum. You are a whole person, you are becoming a parent. How can we support you through that whole journey? Yeah.
yes, traumatized newly pregnant people are going to be nervous and scared and need some extra
Yeah.
support for sure.
Yeah.
It's going to be hard to relax into it during pregnancy.
Yeah.
I'm so, so grateful that you were out there doing work in the world, that we found each other, that joy is one of your most important driving forces. Just,
Yeah.
yeah, so, so glad to be family.
Thank you. Likewise, Chrissy.
Yes.
My heart is so happy knowing you. Yeah.
Yes, yes, yes. Um, all right. Last thoughts on solving for joy, Erica.
Oh, so many thoughts. Okay, so one thing I've learned because I'm a doer is that joy does not happen when I'm multitasking. It just
Ooh,
doesn't for
snap.
me. Yeah.
Snap for us Enneagram
Um,
threes.
I
Shoot.
know. I'm an Enneagram 4, which is interesting, but still, like, I actually have time on my schedule that is like white space. Like, it's truly like, and even if it's just a half an hour every day where I'm like, there will be no screens, there will be no anything. Like, this is my time, just intentionally slow down. Otherwise, I'm like, it's my to-do list because my dopamine is like going off left and right, right? So I have again, it's like that structure and the spontaneity. Like, you need both, but there's certain things I put into my life. Like, daily meditation always happens. Like, there's some things that I just do because I know that that's the foundation for me to have like a healthy life. And so slowing down, as hard as it is for me to do, because like, it is safe to rest is a mantra of mine. The joy happens in the slow moments and the unexpected moments. And I just have to say, like, yes, like, you need to give up the dopamine, and it is good for you to give it up because, you never know when you're going to have those moments. And so slowing down is really helpful. And then I would say curiosity. Like, curiosity is something I've gotten a much greater appreciation for over the last several years as I've been doing a lot of work on myself, right? And understanding this human who is here. And just that takes space too. We need spaciousness to allow for these things, which is kind of hard, especially with the way our lives are. But those things help me to cultivate more joy because I can focus on being in the moment. And when I'm just sort of in my to-do list when I'm just racing around and multitasking. And even when I don't have transition time, that's another thing I've learned. I saw that Jessie Mahoney was on your podcast. Like, she taught me this, like, have transition time in between things whenever possible, because then you can integrate those experiences, right? And then you can savor, right? The gratitude practice alone is not the thing, in my opinion. It's the savoring of that gratitude and like letting it be embodied. That's where the magic is, right? So I think when we can slow down just a little bit and transition in between our things, even if it's just like a breath or a moment to say like I'm transitioning, then we can then be present for all of it in a way that, like, if my brain is like 30 minutes ahead, I'm not in my present moment, right? So I strive for that. It doesn't always work, but it's one thing I recognize as one of the ingredients for me being my healthiest self.
So many gems. This one's worth like 3 listens. Erica, thank you so much.
Thank you,
I
Chrissy.
adore you. I appreciate you.
Likewise.
We'll talk
Likewise.
soon.
We will talk soon.
loveandsciencefertility.com. Thank you once again to Dr. Erica Bove for this generous, grounding conversation. I loved it so much. The way she holds space for her patients, for their stories, for joy itself is such a gift. I know so many of our listeners are walking through complex chapters right now with infertility or other challenges, and I hope this episode offered a little gentleness and hope. Next week, I will be joined by Dr. Una, physician, founder, and powerhouse in the conversation about what's possible when we stop playing small. We'll talk about reclaiming agency, building lives that fit, and the joy of stepping into our own story. I cannot wait to share it with you. If you're a physician coach looking for community, come join us this November at the Physician Coaching Summit. It is one of the most connected, joyful spaces I know of. And you can learn more at thephysiciancoachingsummit.com. If you're curious about what coaching might open up for you, visit joypointsolutions.com. I'm happy to hop on a call and chat about possibilities. And remember, I'm a doctor, but not your doctor. This podcast is for educational and inspirational purposes only and is not to be construed as medical advice. Big thanks as always to our creative crew, Kelsey Vaughn, Alyssa Wilkes, Shelby Racken, and Sweet Sue. And to you, thanks for being here. May you find a new way this week to solve for joy. We'll see you next time.